Okay, we're connected. You may begin.
Okay, good evening. I'm Richard Nobles, and I serve as chair of the Licensed Psychology Advisory Committee with the Kansas Behavioral Sciences Regulatory Board. Today is Tuesday, the 6th of January, 2026, and I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic media. Linda Heitzman Powell is not here. Uh, David Stevens,
I do see him on the Zoom call.
I do see him on,
I'm here. Sorry.
no problem. Jennifer Fontaine,
I'm here.
Matthew Golker,
Present.
Jessica Hamilton is going to be late. Edward Hunter. Tiffany Johnson is not able to be with us today, and neither is Sarah Kirk. Christopher Leonard,
Here.
Jay Middleton,
Here.
Robert Twillman,
Here.
and Daniel Garlock.
I am here.
I note the following staff members are also present: David Fye
Here.
and Leslie Allen.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Richard. And before we go into the next bit of the information here, there is someone I'm going to let in from the waiting room, and we'll verify this person's a member of the committee.
Okay.
And I just let someone in from the waiting room. Your name is currently listed as iPhone. Could you identify yourself?
This is Jessica Hamilton.
Perfect. Okay. I will just rename you real quick. But thank you, Jessica. Appreciate you attending. We just started the meeting, and I'm about to read the introductory information concerning the meeting being held remotely. So this is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time for public comment as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On December 18th, 2025, we sent the notice of the advisory committee meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website at ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may contact the board office by sending an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one currently on the line, but if I hear someone beep over and introduce themselves, I will let you know.
Thank you very much, David. This meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda. And that is, there we are. The approval of the agenda. Do I have a motion to approve the agenda as it stands?
Motion to approve the agenda.
So Jay moves. Do I have a second?
Second.
And Jennifer Fontaine seconded. All those in favor, please say aye.
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 All those opposed, same sign. The motion passes. And with that being said, I'd like to introduce our newest member to the Licensed Psychology Advisory Committee, Dr. Daniel Garlock. If you would tell us a little bit about about where you are in the state and the work that you do, that would be great. And we can also go around and briefly introduce ourselves in terms of what it is that we do here in the state of Kansas. So I'll turn it over to you.
Sure, thank you. So I'm actually I'm located in Topeka, Kansas, and I have my hand in a few things right now. I'm primarily in private practice with a group practice that's based in Olathe. So I also have an office in Topeka, and then I'm in Olathe 1 day a week seeing clients. I also do some teaching at Washburn University, and then I'm contracted with Family Service and Guidance Center, where I do some supervision to their interns there. And yeah, so that's primarily what I'm doing.
Thank you very much for your desire and your willingness to serve on the committee. We very much appreciate the service. I can briefly say something about myself again. I'm Richard Nobles. I'm the chair of the committee, and I am based out of Overland Park. I work at the University of Kansas Health System in KCK, where I'm a clinical health psychologist, and I recently opened a private practice. So those are the couple of things that I do here in the state. And I'll just go across the screen and call on folks as I see them. I see Chris Leonard is next up under David Fye, at least from my view.
Hi, Daniel. I'm a licensed psychologist. I'm the director at Wichita State University's Counseling and Psychological Services. I've been in that role now for close to 3 years, I believe. So I think somewhere around that. It's complicated, but I've been at Wichita State again since 2018 as a clinical director. So.
Thank you very much. Bob.
I'm Bob Twillman. I'm the manager of psychology services for St. Luke's Health Center in Kansas City. Live in Lenexa. I'm also volunteer faculty for the KU Department of Psychiatry.
Thank you very much, Bob. Jay.
I'm Dr. Jay Middleton. I'm located in Pittsburgh, Kansas, with a private practice focused mostly on psychological assessment, which I conduct for a variety of governmental and non-governmental organizations.
Thank you very much, Jay. Jennifer.
Hi, Jennifer Fontaine. I'm a VA psychologist and also in private practice in Brookside.
Thank you very much, Matt.
Hello, Matt Gelker. I am in Manhattan, Kansas, and I own a group practice here with my wife.
Thank you very much. David Stevens.
Hello, I'm David Stevens. I'm trying to join from my computer so that I can have my camera on. Sorry about the delay. I am a public member of the All right, did not fix it.
So now we may have an echo. I thought I heard the beginnings of one. There it is.
Okay, I think that's been resolved.
You were saying, David?
It looks like I'm still connected from my phone, but maybe you've been able to get that taken care of. Can you hear me?
I went ahead and just
Yes.
put phone in the waiting room, so I think we should be good.
Okay, thank you. Sorry about that. Technical issues. I'm a public member of the BSRB. I'm an attorney at WellSky. I do not practice in this field, but I enjoy participating in the committee.
Thank you very much, David. Jessica.
Hey, it is back to school day, so we have multiple activities that started this evening. So I apologize that my camera is not going to be on. But I'm Jessica Hamilton. I'm at the University of Kansas Medical Center, and I am a clinical health psychologist working with psychiatry residents and psychology learners at all levels. And then primarily my clinical practice is with head and neck cancer and pre-surgical evaluations for different types of medical interventions.
Thank you very much, Jessica. Much appreciated. And we totally understand how your camera would be off. Thank you very much for joining us with all the busy things that are going on for you. And I recognize the presence of Edward Hunter. Ned, we are introducing ourselves to the newest member of the committee, Dr. Daniel Garlock, and we're just going around to have people introduce themselves to say a little bit about where they are and what they do. And I'll land on you.
Hi, Dr. Garlock. Nice to meet you. I go by Ned, even though I'm Edward Hunter. So that's how I roll. I'm also at University of Kansas Medical Center, where I am a clinical psychologist, work with outpatient population in psychiatry. I also am director of training of our several different levels of psychology trainees. And my daughter recently had our first grandson, and we saw them over the holidays. So I'm still just aglow with that.
Congratulations to you.
Thank you.
And we have two staff members present. I'll go with Leslie Allen, the Assistant Director of the BSRB.
Good evening. My name is Leslie Allen. I am the Assistant Director and Licensing Manager for the BSRB, and I have been in several positions in the board since 1999.
Thank you, Leslie. And last but not least, David Fine.
Thank you, Richard. I'm David Fye, Executive Director for the BSRB. And Dr. Garlick, welcome to the committee. It's been a pleasure to be working with you on it through email, but welcome. I think you'll find this experience very valuable. In my role as Executive Director, I officially work for the 12 members of the BSRB board, but most of my work is here on site at the BSRB office overseeing the staff. But I also try to attend the National Association meetings to represent the state, and board members do that as well. If I can help you in your role as an advisory committee member, please reach out to me or Leslie. We're happy to help get you connected. But we primarily focus on licensing individuals in the 7 professions regulated by the board, and then also investigate complaints against practitioners and just try to make sure that things run effectively and efficiently as possible.
Thank you very much, David. And I'll move us along to the review and the approval of the minutes from our last meeting in October. All of you received the minutes previous to the meeting this evening. And first, I'll take a motion to approve the minutes. Anybody want to move?
I'll move the minutes.
All right, I heard Jennifer first and a tie between Bob and David Stevens as the second. Any discussion about the minutes? Or any changes that need to be made? All right, seeing none, all those in favor of the approval of the October 2025 minutes, please say aye.
Aye.
All those opposed, same sign. The motion passes. I'll turn it over to Dave Fye for his executive director report.
Thank you, Richard. Each one of the advisory committee meetings, I try to provide some updates on BSRB operations, highlight some legislative items that are relevant to the work of the board and the advisory committee, and then also inform you about items from the most recent board meeting. And so we'll go ahead and start with some operations update. Some of you, most of you have already undergone the annual training for board members and advisory committee members. If you have not already done so, I think maybe there's 2 or 3 members of the committee that still need to complete that. And please let me know if you have not completed that. I'll cross you off my list once you do. It's about an hour-long annual training. We go over some of the helpful information about the role of the BSRB, the role of the board, and then also the advisory committee, the role of members to essentially assist the work of the agency and the board. And then we talk a little bit about some of the specific rules that need to be followed as a member of the advisory committee. For example, as a state agency, agencies must abide by the Kansas Open Meetings Act. They also must follow things under the Kansas Open Records Act. And so that hour-long training really goes into the details, and it is a helpful annual training. So if you have not already taken that training, please go ahead and use your link to that, and then review that, and then just send me an email when you get done, and I'll cross you off my list. But most members already have completed that, so I appreciate those of you who have already undergone that, and we'll get the rest completed here in the near future. I always try to remind members of the advisory committees to consider activating your free CE broker account. This is something that the board worked on to allow all licensees to have free access to an account with CE broker to upload your documentation of continuing education once you complete those hours. This is helpful in that if you are audited at your license renewal, if you are using the free services under CE broker, the board is able to complete the audit very easily by logging into the portal, verifying that you have the hours and that they're in the appropriate categories. No one is required to use this, but I do encourage all licensees to use this if they think it would be beneficial. So I would encourage you, if you have not already done so, please consider signing up for that. I think it'll be a helpful tool for licensees. In terms of some other operations updates, we're going to talk about the survey reports, but essentially we are in the closing stages of our survey reports that we have been reviewing for the last few meetings. Last year, we did surveys of all permanent licensees under the BSRB, and we had responses back from about 4,000 individuals, which is a lot of really good, helpful information. We've been working with draft reports for each of the 7 professions, and we are in the process of converting those to final reports. We should have those all finalized by this coming board meeting on Monday. So once we do have those finalized, we'll send a message out to our licensees to thank them for contributing to the survey responses and also to provide the link for where those finalized reports will be located on the agency's website. We also hope to have a draft comparison report. Some of the questions were very similar between professions, and I think it'll be really interesting to kind of see the information as it relates across the professions. So just want to let you know that's one of the other items that we are actively working to complete, and we are in the closing stages of that process. Moving next to some legislative items. The Kansas legislature every spring holds a legislative session that lasts for about 90 days. Now, how those days are calculated depends on legislative leadership in each individual session. And usually the legislative session starts the second week in January. The agency responsibility for the BSRB is to submit a budget request or a revised budget estimate in the fall. Usually by October 1st, but preferably by September 15th. And we provide that to the Division of the Budget as well as the Legislative Research Department. The Division of the Budget historically has reviewed that. The governor has made recommendations on agency budgets, which are released when the legislative session starts. Usually it's the day following the State of the State address. However, last year, the legislature took a different approach to budgetary items and held some special budgetary meetings in the interim. And this year, the legislature has done something very similar. So a lot of the agency budgets have already been reviewed by the legislature, at least by one committee in the fall. And then historically, what happens in the spring is both House budget committees and then also Senate subcommittees review each agency's budget submission, make recommendations. Those are forwarded to House Appropriations, Senate Ways and Means, and then ultimately it all comes together in an appropriations bill. This year, as I mentioned, the legislature is using a different process. And so about 2 weeks ago, the Legislative Coordinating Council, or the LCC, authorized some additional interim days so that agency budgets could be reviewed prior to the beginning of session. And those interim days began today for the House Higher Education Budget Committee, which is the budget committee where the BSRB's budget is usually reviewed by that committee. And so I presented testimony today to that committee on behalf of the BSRB, basically explaining the different budgetary items and answering questions from committee members. We did not ask for any adjustments from what was already approved for fiscal year 26 and 27 by last year's legislature, with the exception of one technical adjustment in 27. And that is what you're going to find for a lot of agencies to continue a salary increase that was put into place by the 2025 legislature for all state agencies, just based on a quirk in the budgetary system. As biennial agencies like the BSRB have 2 budget years, and so that money needed to be authorized for both years. But with that, if that item, the other budgetary items were basically very smooth. And I think our budget presentation was well received by the members of that committee. So As I said, the legislative session has not started yet officially. So once the legislative session starts next week, we will receive information at some point about when the budget committee will meet again for recommendations on the agency's budget. And looking forward to those. At a certain point, the budget for the agency will go in front of the House Appropriations Committee. They'll have the opportunity to make further adjustments. But the good news for licensees, while we do have some small increases in cost based on inflationary factors outside of our control, we're not looking at raising fees for any licensees. And in fact, we have put forward regulations to lower original license fees for most of the professions under the BSRB. Those will need to go through the legislative process or the regulatory process, but those should take effect sometime this spring, and we'll be able to put out more information later this spring. So just want to let you know about a couple of those legislative items. That's where we are right now. The legislature, when it starts to meet, the committees will be meeting. There will be bills. I will do my best to track the bills that are relevant to the BSRB and also mental health professions and behavioral health professions. And so I'll do my best to report back to you on any bills relevant to the agency. And then last, I'll go ahead and talk about some items from the most recent board meeting. The board had a full board meeting on November 10th. One of the items that the board is actively working through is a review of the unprofessional conduct regulations for each profession. The board has been reviewing a giant grid that lists all of the different items in all 7 professions' unprofessional conduct standards side by side. And it's looking at the language by profession to see if that language can be standardized. And I believe that the board will likely continue this review at this meeting and then perhaps one additional meeting in March. And I believe they should be very close, if not at the end of that project by that point. And then the board will have the opportunity to make any further adjustments and then begin to have those recommended changes working through the regulatory process. So this has been a long process. I know you as an advisory committee, a lot of you that have served on this committee for the past few years, you've been a part of that process of recommending changes. Your work was not in vain. It was very much appreciated. And I think the end product will be very, very helpful for licensees. So we are getting close to the end of that process. Additionally, at that board meeting, the board has a complaint review committee that reviews investigations by our investigators when individuals submit a complaint against a practitioner. Those are investigated, and then a report is provided to a subset of the board. The complaint review committee historically has been 5 members of the board, but the board recently voted to expand that to 6 board members. And so board chair David Anderson is the 6th member of the CRC. And so I want to make you aware that that process had changed. The investigation policy for the board is available on the BSRB website if you are curious in learning more about that area of the operation of the BSRB. But moving forward, he will be a member of the CRC and actively volunteering his time in that capacity as well. So I know we have a lot of items on the agenda, so I'll keep my report short tonight, but happy to answer any questions if anyone has any questions on the items I talked about or anything else.
Any questions for Dave regarding his report? I just want to say, Dave, thank you so much, as always, for going in front of the legislature and presenting necessary items about the BSRB. And I look forward to hearing more from you over the course of this legislative session regarding bills that might be passed and enacted that pertain to not just psychologists and licensed psychology, but the other mental health professions that are under the BSRB. With that being said, the next item on the agenda is an update on the SIPAC, excuse me, multi-state compact, and that would be me. A few things. One, I have volunteered to serve on the Finance Committee for SIPAC, and we met earlier today for about an hour and a half. Excuse me. And we had a significant discussion regarding the future finances of SIPAC. I can't get into a lot of what we discussed because it hasn't yet been presented to the executive board. However, once that information is available and has been presented to the e-board for SIPAC, I can talk a bit more about some of the financial decisions that will be made over the course of the next fiscal year. Excuse me. SIPAC also had its annual conference on November 16 and 17 of 2025. I was in attendance of said conference via Zoom. I was not able to go in person. A few things that were takeaways from the SIPAC annual meeting. One is that there are 43 states that have initiated or that have the compact as live, and there are two other states that have legislation in the works to join SIPAC. One of which is New York State, and that will be really big if the New York legislature passes the law so that they might be a part of compact. We are looking very forward to having New York join because there are a lot of psychologists in New York, and that could be really helpful in helping, especially the states that are around New York that are smaller, like Vermont and New Hampshire, when it comes to the need that they have to have psychologists on board and do the work that we do. In terms of the number of holders of SIPAC privileges, the number of folks who have telepsychology privileges is 18,130 members. And in terms of those who hold a temporary authorization to practice in person, that number is 1,130 folks. I would encourage all of you, and I had not joined SIPAC before becoming the commissioner, and I definitely see the value of being a SIPAC member and holding an authorization to practice in these different states across the country. There are a lot of states, and I know that those of you who, like for example, Jay is in Pittsburgh. For those psychologists that are in rural areas, it's really, I think, important to have as many psychologists join SIPAC so that underserved populations in rural areas or in urban areas that don't have access to psychological assessments very readily, I think that it would be really helpful for as many of us to join as possible. I don't have the number and I forgot to get this, and I apologize, the number of psychologists in the state of Kansas that has Kansas as the home state for their license. So that is something that I usually try to bring to this meeting, and I will do that. And the next time that we meet together, and well, that would be next month, it's around 120. So I'll have the precise number then. In terms of what was discussed at the annual meeting, another big takeaway was that we passed a rules provision with respect to an in-person requirement when it comes to their graduate programs, when it comes to an applicant's graduate program to become a member of SIPAC. As it is now, if an individual attended an APA accredited school, they meet the in-person requirement. If they did not attend an APA accredited school, that was what was discussed, and it was passed that there be an in-person requirement of a year of being on campus. For those of you who have been on the committee, and Daniel, I'll kind of clue you in on this. We had revised our regulation when it comes to an in-person requirement. We rolled it back earlier this year, and SIPAC has initiated a requirement that an applicant come from a graduate program where they were on campus at least for a year. And that was something that was pretty important to the members of SIPAC. There was discussion about it. I won't get into all of the details because I realize we do have a lot to talk about today, and I'm already talking pretty quickly. So that means that I'm trying to get through all this stuff. That was really important. And that is where I will kind of leave it there. There's a lot of other things that I could fill you in on, but the most important thing I think that came from the SIPAC meeting was the passing of the rule that there be an in-person requirement for those that did not attend an accredited institution. Any questions regarding my report? And Dave, I would encourage you, if you have anything else that you might add to what I've said.
Richard, I thought you did an excellent job and really appreciate you serving in that capacity as commissioner and getting involved, serving on the bylaw or the finance committee as well.
And the bylaws, the
bylaw committee.
Reformation of the bylaws. And that is something that I'll talk about. It may not be this next LPAC meeting, but it might be the one that's in April.
Yeah, no, it's wonderful. I appreciate you getting so involved. I just wanted to highlight a couple documents that are in the packet of materials for the meeting too. One of those is that SIPAC newsletter. We received a new one of those in October of 2025. So if you are new to the committee or relatively new to the committee, you may find it helpful to review some of that information. It lists the SIPAC commissioners and then some breakdown of some of the SIPAC information. Additionally, there is a new rule for SIPAC that is open for comment. And that is the notice of that was posted on the BSRB website. This was posted back on December 1st, and it's open through February 20th. Written comments are available for that. And Richard, did you want to talk about that, or do you want me to cover that open?
Please go ahead. And thank you, because I had forgotten to write that down.
No problem. So this is a notice of a proposed rulemaking for SIPAC, and essentially, as Richard talked about, there is one of the funding mechanisms for SIPAC has to do with something called an assessment. And what the assessment does is it looks back at a state and it says, okay, over the course of the previous year, how many licensed psychologists who claim, let's say, Kansas as their home state, how many individuals practiced under SIPAC authority that listed Kansas as their home state? And then for every member who did, they assess Kansas a $10 charge. And so for Kansas, that would be the BSRB. And if there's about 100 people or 120 that are practicing, $10 times the 100 or 120, and then that's how much the BSRB will need to essentially pay to SIPAC as part of that assessment charge. And so that is one of the funding streams in addition to the other charges that individuals pay themselves when they practice under SIPAC authority. Well, as larger states are joining SIPAC and the numbers continue to grow, I believe there was some interest in maybe providing a limitation or a cap in how much the assessment could be. And so basically, this would be a change to SIPAC Rule 10.2, the annual assessment of the compact states. And it would essentially say that in any given year, the annual assessment would be above or as low as 0. So it does give the commission some flexibility there. And then it does say also, notwithstanding any adjustments to the annual assessment formula, the total amount assessed to any one jurisdiction can be no greater than $6,000 annually. So for Kansas, I think the amount has been a little over $1,000 every year. But with some of these larger states where a large number of practitioners may practice, that could add up very quickly. So this would set a cap at how much states could be assessed. And so I think those are the two items that are most relevant to this rule. And Richard, I know that you wear a couple different hats serving on the finance committee, but I'm curious if you have any thoughts on this potential rule in terms of if the advisory committee should make a recommendation to the board regarding the specific rule that's open for comment, or if you have any thoughts on those two things there.
Thank you very much for asking. I think that when it comes to the rule and the cap, I think that would be I think it would be a really good thing for for them to pass the cap, pass the cap rule, especially as, like you were saying, Dave, as larger states continue to become members of SIPAC. So we're thinking like Texas and Florida and not Minneapolis, Illinois and Pennsylvania, those states that have an abundance of psychologists, um, those boards in those states are going to be hit harder by the fee that's being assessed. So I think that there is a good faith effort to keep costs down when it comes to the fee assessments. And as some of you know, if you may be a part of SIPAC, there's already the renewal fee for the authorization, and there's also the initial fee for the application to become authorized. There's already a lot that's going into the coffers of SIPAC. So I think that this is something that I would be more than happy to approve as a cap. If you guys have any other recommendations or would want for me to give you more information, I would be more than happy to do so. And thank you, Dave, for reminding me about that. Any questions for either me or Dave regarding this?
Richard, thank you for the report regarding SIPAC. I just wanted to clarify the requirement of a year in residency. Is even for accredited programs?
No, Ned, that's a really good question. Those programs that are accredited, those folks applying from those programs are deemed to have met the in-person requirement. Because if they're accredited by APA, SIPAC said, that would be good enough for us.
Thank you.
Now, I can't remember, and this will become relevant over the course of the next few years. I don't remember if PC SAS is also included as a accreditation that would be acceptable, where folks would not have to meet an additional in-person requirement. I think it is, but please don't quote me on that. I would need to go back and reread the rule. Any other questions?
And Richard, it's not really a question. It's just kind of, well, I guess it is a question. If the advisory committee felt strongly about this proposed SIPAC rule, we could make a recommendation to the board and ask the board basically to direct me to provide some comment regarding this rule. So that is one of the things the advisory committee is asked to do, is to make recommendations to the board on potential changes to statutes, regulations, or potentially things like this. And so the board of the BSRB is meeting this coming Monday. So if you do feel strongly one way or the other about this proposed rule on the cap, there could be a recommendation tonight that would be forwarded to the board, and then the board would have the ability to decide, on behalf of the state of Kansas, do we want to provide comment on that rule? So
anyone feel strongly one way or another? I would say then that it would be, I think that it would be all right if we move forward and said that on behalf of the state of Kansas, that the rule be passed with respect to capping the assessment fee for states at $6,000.
okay, and we can take that recommendation by consensus, as long as there's not a majority of advisory committee members that would object to that. So are there any advisory committee members that would object to forwarding that as a recommendation to the board? Okay, then if not, we'll mark in the minutes from this meeting that by consensus, the advisory committee recommended to the board that we provide comment during this period in support of this proposed rule change. So thank you for that.
Thank you all. I'll move us to the next item on the agenda, and that's an update from the annual ASPPB meeting that that took place in St. Louis back in October. And Dave, I can have you kick things off, and then I can fill things in. Linda's not here, so it'll just be me filling things in from that meeting.
And I'll try to frame the stage for what took place at this annual meeting. So for those of you that are not familiar with ASPPB, the Association of State and Provincial Psychology Boards is an association that assists regulatory boards for the psychology profession, like the BSRB. And there are some standalone boards in other states. There's composite boards. There's things called umbrella boards. But basically, they assist all licensing boards for entities that regulate psychology. And that includes states and also Canadian provinces and some territories too. And so once a year at the annual meeting, the business of the association is done. Last year, and I'm basically talking about the fall of 2024 briefly, there had been a decision by the board of ASPPB, which oversees the licensing examination for the psychology profession, the EPPP. The ASPPB board, prior to that time, had made a decision to require a second test for states that wanted to use the EPPP. They had made a decision in the past to implement a requirement that states would have to utilize the EPPP2 as of a certain date. Last year in 2024, there were a number of states that were opposed to this requirement, and that included the state of Kansas. We worked with representatives from other states, namely Texas, Tennessee, and others, and basically the board is not opposed to having good standards for licensure, but because of a number of different reasons, the board was opposed to adding a new requirement of this second test. And so we were able to work together with representatives from other states. And at the end of that conversation, there was enough support to convince the ASPPB board to withdraw their decision. So they were no longer going to be requiring states to have the EPPP2 as a requirement for licensure. But what they wanted to do as an alternative was to begin a process of putting together a task force that would look at redesigning the licensing examination, and it would combine components of the EPPP, which they had called a knowledge-based test, with the EPPP2, which they had described as a skills-based test. And so over the past year, since that fall of 2024, there was a task force put together of representatives from different states and staff of ASPPB working on the development of that new examination. Additionally, because when we worked with those other states to bring to a head the opposition to that requirement of the second test from ASPPB, it called out that there were some technical things that needed to change with that association. And as a member state, we had a responsibility to make positive changes. And one of those was to also make some changes to the bylaws for that association. So last year in 2025, I served as one of 7 appointed members to a task force that focused on making changes to the ASPPB bylaws. We met several times, worked in subcommittees to come up with different ideas for the ASPPB bylaws. One of my main focuses and goals as part of that task force was to open things up a bit more, to allow states to bring forward resolutions and to try to see if we could work with more transparency and kind of come together as a larger association with representatives from different states. And so I found that experience to be very beneficial. And at the annual meeting in 2025, one of the things was there was a large number of changes for the bylaws of that association that were presented And there was an entire day where representatives from states went item by item through, I think, maybe between 15 and 20 different items as proposed changes to the bylaws. There was a healthy amount of discussion. There was a parliamentarian who was navigating all of that discussion. And I think by the end of it, some of the things put forward by the committee were adopted and some of the things were rejected. But I think it was a great opportunity for a lot of states to be heard. And I think those bylaws are in a much, much better spot. So that way we can have better representation at a national level for future changes. And I think the board also heard that states want to have a more active role and do not want to be told what to do in some of these important areas, but instead want to have more control over the standards for licensure amongst different states. So wanted to make you aware that was one of the major things that took place at the ASPBB annual meeting. Additionally, there were some updates from that task force that's looking on redeveloping the ASPBB EPPP. And so there have been some town hall meetings. You may have seen some postings about those. They've been for different groups. I think one was dedicated to students, one was looking at licensed practitioners, and there were a couple others, I believe, that took place just to kind of let individuals know what has taken place in the past and what the future looks to be for that as well. So those were some updates that took place there. I do want to thank both of the psychology board members. Richard attended that annual meeting. Linda Heisman Powell also attended the meeting, and they were very active in the discussions and really did an excellent job at making sure that Kansas's voice was heard. And so I want to thank Richard and also Linda. Really appreciate you attending that meeting and playing such an active role. And Richard, I'll turn it over to you. And if you have any other takeaways from that meeting, please feel free to share.
Thank you very much, and I appreciate all the work that you have put into working with ASPPB on especially this matter, the two matters actually, with the bylaws changes, which were substantive and really important to address, and also your work with respect to the EPPP and its evolution. I attended kind of aside from that, but related. The most recent and last, I think this was the last town hall that was scheduled. It was in December. I had gone to two. There was one earlier in the year. I believe it was like September, and there was one, I believe it was in December. And just a couple of notes from the December meeting. The slides that were presented at the meeting are or should be posted now on ASPPB's website. And if you need help navigating there, I would be more than happy to assist you in getting there. That meeting, I believe that was the one for licensed practitioners. And there were a whole number of people that attended the meeting. I couldn't see all the attendees because it was on presentation view, but we were told that there were a whole number of folks that were there, and they presented on what the timeline would be for the rollout of the new EPPP and the procedures and mechanisms that are taking place to get to the eventual rollout. And they're aiming for a rollout in late 2027. So about 2 years from now is when they're hoping that the new EPPP will be done. The meeting went over, I'm just looking at my notes, folks who might want to participate in the beta testing for the EPPP, there will be a call for that, including clinicians like ourselves and researchers and educators are also called to be beta testers for the EPPP. That will be later on this year or into next year, if I'm reading my notes correctly. I think that the process, and this is a little editorializing here, I think that the process that has been taken when it comes to getting us to this point has been an evolving process. And I think that we're on a good pace and page to get us to an examination where yes, it'll combine those two skills, the knowledge-based skills and the kind of skills-based portion of things. I think that we're getting to a place where things are going in a good direction. In terms of the rest of the ASPPB meeting, a big takeaway that I had, and this pertains to the work that we do with the BSRB, had to do with supervision as a disciplinary mechanism. That was the last meeting of the entire um, 4-day conference, and that was really, really good in terms of what it means to be a supervisor for someone who is under discipline. And I can talk much more about that. That was probably the most fascinating meeting, aside from the bylaws meeting and kind of the revision of it. That was really helpful in terms of informing how we as a regulatory body can utilize supervision as an appropriate way to help licensees that have done things that would get them disciplined. So that's my kind of long and short takeaway of what happened at the ASPPB meeting. I won't get into all the details, but any questions about either of our perceptions as to what happened during the meeting? I realize that's a lot of information that's just kind of blown at you about ASPPB as well as SIPAC. Any questions that you might have? Well, seeing none, I'll say this. Please do, if you think of anything, you can email Dave or you can email me. I'm more than happy to chat with you offline about other matters that went on at the meeting. I'll move us on to the next item on our agenda, and that is to discuss old business. And let's go in order here. The first matter under old business is the review and discussion of the survey of psychology licensees. And Dave, I'll turn it back over to you.
Okay, thank you, Richard. So over the last few meetings, what we have been doing is discussing about 2 or 3 questions per meeting, focusing on the survey results from the survey of licensees that took place in 2025. And so 2 questions we wanted the advisory committee to focus on specifically at this meeting included the last 2 questions on the survey. There was a question that said, do you have any additional ways the BSRB could protect and serve consumers of services offered by BSRB licensees? And then also there was a question that said, do you have any additional feedback or comments for the agency or for the advisory committee? So I will share my screen here and we can look at the summary information. One of the neat things, if you like data, is on these draft survey reports, we included summary information, but on the questions that allowed for an open-ended response, we also did our best to include responses from the individuals so you can kind of get a tone of the voice of individuals. And so I'll cover some of the summary information for these 2 questions, but I'm really curious to hear you all as advisory committee members. Was there information in the summary or was there information in the open-ended responses in the appendices that really stood out to you or surprised you? And so, like I said, I'll share my screen here and we can take a look at that survey. So you should be seeing page 11 of the survey report now. And basically, as I said, question 17 on page 11 asked, based on your experience as a licensee in Kansas, do you have any recommendations on additional ways the BSRB could protect and serve consumers of services offered by BSRB licensees? 297 LPs answered the question. 92 licensees reported having no recommendations or additional ways the BSRB could protect and serve consumers of services offered by BSRB licensees. So I do find that notable. About a third or so of the respondents when asked, do you have any different items you'd like to highlight for the agency on ways we can better protect the public? They said no. So, but for the individuals who did respond, that there are some ways in which we can better protect the public. 92 licensees, well, let's see, 12 mentioned insurance and reimbursement. And then specifically the most frequently reported responses were in the areas of telehealth evidence-based practice, complaints, master's level psychologist, supervision of other professions, children and families, and then offering free continuing education opportunities. Less frequently identified than the previously noted items, other licensees pointed out other issues such as social media, SIPAC, ethics, and professional burnout. Other respondents indicated the EPPP and postdoc hours. Concerns were also raised regarding the term psychologist and vulnerable populations. And let's go ahead and take these two questions together. So when we open it up for comments, you can comment on either of these two questions. But question 18 asked, do you have any other comments or feedback you think would be helpful for members of the advisory committee to receive when evaluating possible recommendations for changes to the statutes and regulations of the psychology profession? 180 LPs answered this question. 91 respondents stated they had no further recommendations, about half. But for the individuals who did, the most frequently reported topics in response to this survey question included similar topics to the last one: telehealth, insurance, master's level psychologist, and protecting the title of psychologist. Other respondents noted medications or prescriptions, use of artificial intelligence, and allowing LPs to supervise other professions. So, looking at this summary information and then also the open-ended responses in the appendices, which are on pages 44 to 52, and then also 53 to 59. Did anything strike you when you were looking at this information in preparation for this meeting? Was there anything that you anticipated seeing that you did? Were there things that you didn't expect to see that surprised you, like I said? So I'll turn it over to all of you, and please let me know if you have thoughts or discussion on those topics.
I think that's something that stood out to me, and this was more about the whole of the report. What one thing that stood out to me was the numerous instances where LMLPs were mentioned and the degree to which LMLPs should be regulated and the protection of the title of psychologist. That just every time I read through this, that came up. And I don't know other than to just make that a notation that this is something that, continued to come up in the responses. Not sure that there's anything else to say except that, this is something that even though only a few, I shouldn't say only a few, even though there was a smaller contingent of folks who responded to those questions in general, like for those who did respond, there was this sort of theme about the regulation of LMLPs and LCPs for that matter, the second level of licensure.
I'll add a note too, and this is not something that was only with the psychologist responses, but I did see several individuals who answered the survey said they would like the BSRB to advocate more. And I think there may be a little confusion about the role of the agency. And this is not uncommon. We saw this with other professions as well. But this is part of the reason why we phrased this question the way that we did. Because the charge to the board by the legislature is to be a public protection agency to ensure that members of the public are protected. And so while we do work with licensees to make sure that individuals become licensed and are regulated, our primary charge is public protection. And so, we hear that there are requests that we could be of assistance in terms of maybe higher reimbursement rates or health of the professions, and we are certainly not opposed to that. It's just a little outside of our lane. And so I did note that was sort of a common theme as I'm looking in terms of this question between the different professions. Request for the BSRB to be advocates. It's a little outside of what we do, but I did see that as a common theme.
That's a good point. I noted that also throughout the document.
Another item that I noticed is even for individuals who responded that didn't have specific recommendations, there did appear to be a few that were appreciative of the opportunity to provide survey responses. So this is not something based on our limited staff and resources. We won't be able to do something like this project every year, but we do hope to follow it up maybe in about 3 years. Some of this information will be interesting to track over time, but it was helpful to get responses back from licensees that said, even if I don't have a specific recommendation, thank you for the opportunity to provide feedback and for listening to the licensees. And so we are definitely doing that. We do care what the licensees value and think and want to make things more user friendly and more efficient. And so that was good feedback for us to receive.
Any other observations? And I know that with it being so open-ended, it can be kind of challenging to amalgamate or kind of consolidate some of the things that were said, but would certainly, either here or in another forum, would certainly want to hear your thoughts and feedback around how our fellow psychologists responded to the survey.
But there was something interesting with the kind of the continuing theme of psychologists being able to supervise more master's level clinicians and not being stuck having to get someone else to do that if there's limited folks there. I think that was a theme, I think 4 or 5 times at least, being able to supervise a professional counselor towards a clinical license or a social worker towards a clinical license.
And that has, I think, that is it's an interesting interaction between psychologists wanting to be able to provide supervision to other professionals and what the other professionals would like for their own supervisees and their own licensees to experience. And I think that there are a number of folks who have really strong feelings about social workers only providing supervision to social workers, and similarly with LPCs, the licensed professional counselors. There can be strong feelings on both ends when it comes to who would be an allowed person to be able to supervise those licensees and supervisees. Any other observations? Kind of going once, going twice? Well, again, please do let us know if there are things that you've observed, and I appreciate all of you going through this over the course of the last few months and providing your feedback on what, again, our fellow psychologists have said across the state. And we'll certainly keep you posted when it comes to the finalization of the report. I'll move us along to the next item on the agenda, and that is 8B, and I just clicked out of it. And I believe that's the review of the additional regulations that are remaining. Am I correct? And I don't have the agenda pulled up because I accidentally clicked out of it.
And that's
You're
okay.
correct.
Okay.
And I'd be happy to kind of frame this and kind of walk the committee through these items if that would be okay. So. So on these items, there are essentially a list of regulations, and our assistant director for the BSRB and licensing manager, Leslie Allen, we have asked her to take a look at some of these regulations that we maybe haven't discussed in the last few years, or ones that she has identified for edits or recommended changes. And so the process we'd like to go through with you all as an advisory committee is to first turn it over to Leslie on each of these individual regulations. She can kind of talk to the committee as far as if there's any items that she has identified and would recommend for changes. And then we can have any questions from advisory committee members. If you see any other items that you think are appropriate for recommended change, We can discuss those too. And then for each of these regulations, what we will do is ask if there is consensus for the advisory committee to move the recommended changes forward to the board. And if there's no objection, we'll just say that by consensus, those recommended changes will be moved to the board. So that's kind of how we hope these items will go. They usually go pretty fast. And if there is a regulation that Leslie has not identified any changes, we'll ask the advisory committee if you have questions about it or if you have recommended changes. And if there's no recommended changes, we will just make sure to note in the minutes that we have reviewed this regulation. We don't have any recommended changes. But that is helpful too, because the legislature is looking to us to make sure we're being good stewards of these regulations. So some of these may need updates, some of them may not, but it's helpful for us to have a point in time that says we've done our job to review all of these. And if there's things that we need to do, we've done that. If there's things that look good, we've verified that too. So with the first one, that is KAR 102-1-3A, application for licensure by examination, application for temporary license. And I will share my screen on these so we can all look at it together. And then I'll turn it over to, like I said, Leslie Allen, the Assistant Director and Licensing Manager for the BSRB. And she can walk through these and highlight if she has any recommended changes for this first regulation, KAR 102-1-3A.
So Dave, I also included in the packet was the one that I marked up.
Okay.
Do you want to use that instead, or do you want to just?
We can use that one. Can you all see the highlight? This is a different version of the same regulation, KAR 102-1-3A. And Leslie, I'll turn it back over to you.
Okay. First, in lowercase b as in boy, this says that the applicants have to request the forms from the executive director. And this is kind of common in regulations that we've been going over. So I've highlighted it because we're going to change that language. We're going to move toward an online application. So we're going to find common language and that will be changed because even if they request forms from the board, they don't need to bother the executive director. The second thing is in B1C at the bottom of that first page that said references on board approved forms. And currently, we only require references if an applicant doesn't have 4 supervisors completing attestation forms. So I added that, I changed that because throughout this regulation, they used reference form for all of the forms that they're using for pre-doc, post-doc, and references. So I was making that a little different, and I might ask to move it because it's kind of an odd place. I think it should come after the attestations, but and then if you go to page 2.
And Leslie, it looked like under B1A, it was also striking form and just putting the word materials.
Yes, I'm sorry.
And you said under what was the next change?
To C1.
Okay.
So again, if the applicant seeks credit for 1 year of post-doc, pre-doc, it is kind of unclear to me whether they have to use a postdoc their internship year or they can do 2 years of postdoc. That's kind of in different places in the regulations. It's not clear to me, so I'm going to have to ask maybe the attorney and see if it's an if or if it is they have to. But I did change it to 1 year pre-doctoral supervised internship and that they shall submit on board approved forms an attestation from the director or chair of the pre-doc internship program. And then down in number 2, I added if they seek credit for doctoral practicum experience, because you guys had been talking about that, we may wait and add that later since no decision has been made on whether or not you're going to accept practicum hours. So you can just kind of keep that in the back of your head. But I did write down that it would have to come from the on-site supervisor or maybe from the university if that person was unavailable. And then if you go down to D as in dog, excuse me, my voice is not all here. For the postdoctoral supervised experience, again, I changed they used to have to send us names, and then the board would send out forms to the postdoc supervisors. Now they complete the forms and send them in to us. So I removed that and said on board approved forms and attestation from the postdoc supervisor. And removed the language about and who can address the applicant's professional conduct, competence, postdoctoral supervised experience, and moral character. All of that is in the form, and I don't think we have to have that language spelling it out in the regulation. It's not spelled out like that for any other profession, so I don't really see a need for all of that. If again, if you feel it should be included, please just let me know. And then on page 4, E, I changed the sites because of the addition of practicum, so that'll probably just be changed back. In E1, hold on a second. My eyes are getting old. Okay, if a person has not completed postdoc or the exam, they have to, if they want a temporary license, they have to send in an attestation on board approved forms from each person who will be providing postdoc experience. In the application packet, it's called a postdoctoral plan, supervision plan, I think. But that's what they do if they have not completed their postdoc hours. And then number 2, again, it talks about verification of the setting, the name and qualifications of the supervisor. All of that is on the form, on the postdoctoral form. So we don't need that separately. And then down to 5, which is stricken, is now number 3. And then upon completion of the postdoctoral supervised experience, each person who provided postdoctoral supervision shall submit on board approved forms an attestation that verifies the postdoctoral experience has been completed as specified in subsection D. So that's just updating the language, basically. And then on page 5, I guess, sorry, on the bottom of 4, if the applicant qualifies for and obtains a temporary license, that the temporary license shall be active until the temporary license expires, or upon expiration, the applicant may submit a new application, the required fee and all supporting documents. Because there are 2 different ways to get a temporary license. One is if you're doing postdoc experience. One is if you're just needing to take the exam. And in statute, only someone doing postdoc experience can renew their temporary license. The temporary license is good for 24 months. So if someone needs to take the exam, that would give them 8 opportunities during their 24 months temp. So it does not have the option to renew it if you're just doing the exam. And then in G, a temporary license granted to someone who's completing the postdoc experience may be renewed for one additional 2-year period under an existing application. Down in number 3, I just changed it to postdoctoral work experience. And that's really just because since I've come into my position, I have not heard postgraduate. Everyone uses postdoctoral experience. So I figured that would be the best language to use. That goes through on page 6. I've updated postgraduate to postdoctoral several times. Then down in number 3, we have the definition for extenuating circumstances in this regulation. And I struck that because it's defined in the definition regulation. And it should really only be in one spot so that if we change the definition in definitions, we don't forget to change it in every other regulation that lists that language. So it just points back to that regulation. That's all of the changes that I had for that regulation. Unless the committee has any comments or additions or things you'd like taken out. I know.
Oh, go ahead, Lizzie.
No, I was going to say, I know because I'm not a psychologist. I don't speak your language sometimes. So if you have better wording, please feel free to give that to me.
I had a question about the length of the temporary license. That the 2 years is comparable to all other professions, correct? All other professions, like there can be, okay.
Yes, that's correct. But psychology is the only profession that allows a renewal of a temporary license. When completing postdoc, all other temporary license are one issue, no renewal, and it won't be issued again.
Oh. Okay. I'm just processing that because I didn't know that.
Yeah.
That we were the only profession. I think that to your point earlier about the allowance of predoctoral hours to count with respect to experience, yes, and we leave that out for now because we have not arrived at a consensus regarding that matter. Um, I would be okay with what has been submitted by you. I would be okay with making making recommendations for those changes, except for
Okay.
that. Does anyone else have any thoughts or questions or concerns regarding this regulation?
And I would say most of these proposed changes are not going to be quite as lengthy of changes. I think for a lot of
Right.
these, we'll just be modifying one section or two, but this one was something where there were several items. So if you do have questions about any of these proposed changes, please let us know. Or since there are so many of them, if you feel like you would benefit from some additional time to review this and ask the questions, that's appropriate too. So please let us know your thoughts.
All right, maybe we can move on to the next one, and that is KAR 102-1-8, and that's the renewal and reinstatement regulation.
Okay. And Richard, before we move on to the next one, let me just check and see if there is consensus on the recommended changes or if there's any objections from members of the advisory committee. If there's consensus, we can
I just bypassed that, didn't
Yes.
I just bypassed the ask for consensus.
And let me clarify first. There was one item that Leslie had highlighted that the committee has not come to a position on, but Leslie had provided some language if that does um, become a recommendation of the committee. Leslie, was that here
Yeah, that is there.
under
Yes,
two?
yes.
Okay. So
So C2 would be removed.
So let's set this aside, this proposed change under C2. But was that the only item that would be relevant to that, Leslie?
Yes.
Okay. So with the exception of C2, and we'll kind of set that to the side, but for all the other recommended changes in the regulation KAR 102-1-3A, I'll stop sharing my screen and then see if the advisory committee members have any questions or if there's any opposition to recommending those other recommended changes to the board for change to the regulation. So is there any opposition or any questions from advisory committee members? I'm not seeing any questions or opposition, so it appears to be consensus that with the exception of the items in C2, which we will set to the side, there appears to be consensus to move the other items forward to the board as recommended changes to KAR 102-1-3A. Okay, great. We'll move.
Thank you.
Yes, thank you. We'll move on to the next regulation, and that is KAR 102-1-8. And I'll share my screen again. This regulation is titled Renewal and Reinstatement. And Leslie, I'll turn it back over to you, and you can highlight if you have any recommended changes for this regulation.
Sure. And this one, yeah, you were correct in that that was the longest regulation and the most changes. That all the remaining ones are not going to be that detailed. So 102.18, the only change I had is well, wait a minute, I lost a page. But on the first page, under B as in boy, number 3, if the applicant is required to take an exam, the exam fee is set forth in the fee regulation. That should be struck. We no longer take the exam fee. That's paid directly to the examination company. So we need to remove that from the regulation.
Mm-hmm.
With that removed, it would renumber 4 and 5 as
Right.
new 3 and new 4.
And then on page 2, and lowercase c, section 1, the completed renewal form, that should be changed to reinstatement form because once that expires, you reinstate. It's not considered a renewal. And then in number 3, it talks about if the late renewal fee equal to the renewal fee as set out in the fee regulation, and that should be, we need to add some language going into it saying if the license has been expired for less than 1 year, then they have to pay the late renewal fee, because if it's been expired for more than a year, they only pay the renewal fee. There is no late fee. So just clarifying that. And then down in number 6, just removing after November 1st, because it used to be that psychologists, even though their license expired on June 30th, there was another statute that said they could practice until November 1st. That has been removed. So now when the license expires on June 30th, that's when it expires and you cannot practice any longer. So we need to just remove that date.
Okay.
That's all I have for that one.
Thank you, Leslie. Any questions from advisory committee members about those recommended changes to the regulation? Do advisory committee members have any other recommended changes for this regulation? Okay, well, I just want to highlight for the member of my staff who is taking minutes for this meeting, I'm going to try to call out the specific changes so that way she can reflect them clearly in the minutes. The first recommended change you said would be in which section, Leslie?
It's in, on the first page, it's in little b as in boy, number 3, to strike that whole section.
Okay, so I think there'll be three changes for the advisory committee to consider. Striking B3, the language in that. And then for the second item, could you remind me which the second item was?
Sure. C as in cat. Number 1, striking renewal and adding the word reinstatement before the word form.
Okay, so striking the word renewal and making reinstatement under C1. And then the third was under C6, striking the language that basically says after November 1st. So
In C3.
I'm sorry, Leslie, could you say that again?
There's also a change in C3
Okay.
to add language. If the license has been expired for less than 1 year, the late renewal fee equal to the renewal fee will have to be paid.
Okay. And
then.
and then the fourth one, I suppose, would be in item number 6.
Correct.
Okay. Okay, well, I will stop sharing my screen here and see if advisory committee members have any opposition to moving these 4 recommended changes to the board as recommended changes for KAR 102-1-8. Not seeing any opposition, so it appears to be consensus. So by consensus, the advisory committee will recommend moving those proposed changes forward to the board. So thank you for that. I know this is a little tedious, but I do appreciate your time. This is important. And we've been doing this with each of the advisory committees. So the board will have a lot of these to review as well, but we appreciate your time on this as an advisory committee. So next, I'll go ahead and share my screen. This looking at regulation 102-1-8A renewal audit, and I'll turn it over to Leslie. Did you have any recommended changes for this regulation?
Yes, so in subsection C, lowercase c, number 2, it says the original continuing education documents, and we would strike the original and say copies of the continuing education documents, because a lot of things are online, and it's really much, since we've started using CE Broker, we aren't using the originals in that way anymore anyway. But it's really cumbersome for people to have to send their originals. So copies. And then the only other thing that we have been saying for all professions is that we're going to add some kind of language for using a platform such as CE Broker. Since the information's already uploaded to a platform, we won't have to have them fill out the forms and send them in with the certificates.
Okay. And Leslie, would that be a new section?
Yes.
Okay. So the 2 proposed changes would be in C2, instead of saying the original continuing education documents, it would say copies of continuing education documents, and then having a new section that basically clarifies another way to have these available for review would be through a third-party platform supported by the licensing board or something like that, which would allow us to basically point to our utilization of CE Broker as a tool to assist in the audit process. So, any questions by advisory committee members about those two proposed changes or recommendations? Okay. I'll stop sharing my screen here. Is there any opposition to moving those two proposed changes forward to the board as recommended changes? Okay. If not, then we'll say by consensus, those changes have been recommended by the advisory committee, and we will forward those to the board. We'll move on next to KAR 102-1-11, and I'll share my screen again, and I'll turn it over to Leslie. Do you have any recommended changes for KAR 102-1-11?
I do. And it's one that is not, so I don't have the date, but the statute to the authorizing people to have unlicensed assistants approved by the board was removed. It was revoked many years ago, but they left the regulation because they allowed people who already had unlicensed assistants approved by the board to continue with only those people, and this is how they should be supervising them. So, I really don't have any changes in the language, but I thought it might be helpful in the lead-in to utilize unlicensed assistants to add just that were approved on this date or prior to this date, so that people understand clearly they can't be doing this now. This is not an option anymore. Because I do get a fair amount of questions about it. So that was my only thought for this regulation. And I would say, if the committee sees something that's too cumbersome or not cumbersome enough, to let us know, but I didn't have any other changes.
I have a question. In reading this before tonight, and tonight also, I'm wondering if psychometrists were the ones that were targeted with this regulation, because we still have psychometrists, but they don't hold a license. Are they considered unlicensed assistants?
I don't believe so. I believe that um, in the past that they did have people like providing therapy as unlicensed assistants for the psychologists. So I think they did more than that.
Oh, okay. Well, that
And
provides context. Yeah.
yeah, and then I looked at the second page. I would recommend striking C at the very end of the regulation, because it talks about persons receiving pre-doc and post-doc are not required to be registered as an unlicensed assistant. And since we don't do that anymore, that doesn't really flow.
Do we know how many, or yeah, or even if there are psychologists that have unlicensed assistants anymore? If if the statute was struck decades ago?
Mm. I mean, somewhere we have a list, but I would have to find that list and look for each psychologist and question them to
Okay.
see if they're still utilizing unlicensed assistants. So if that's something you want to look at in the future, we could definitely look at that.
Sure, because I would think that, striking the whole regulation at some juncture would be a way to go about it. But if there is still a substantive number of psychologists, or any psychologist for that matter, because there would still need to be a regulation even if there's only one, there are still people that are in these roles. It'd be good to know how many psychologists are supervising these individuals.
Any other questions by members of the advisory committee on this regulation? So if I recall correctly, that the two proposed changes would be under the beginning of the regulation to utilize unlicensed assistants for psychological services prior to or some sort of reference to when that statute was struck.
Right, that the unlicensed assistants approved by the board prior to blah, blah, blah.
Right. Because as of that date, they basically struck the statute to try to stop new unlicensed assistants from becoming unlicensed assistants, but they left the regulation to provide clarity on how they should be treated for the ones that were already providing services. And so that new language would clarify that this was a closed group in terms of when people became unlicensed assistants. And then under Section C, essentially striking Section C. So any questions about those two recommended changes? Okay. Any opposition to forwarding these two recommended changes to the board as recommendations from the advisory committee for change to this regulation? I don't see any opposition, so by consensus, we will forward both of those recommended changes to the board. So thank you for that. We'll move on to the next regulation. And this is a very short regulation. I'm going to go ahead and share my screen, and you can take a look at KAR 102-1-14 in your packet, titled Psychological Group Service. And I'll turn it over to Leslie. Do you have any recommended changes for this regulation?
I do not. I don't have any, well, yeah, it was amended last in 1987. So I really don't have any historical knowledge about this or any recommendations. It's just talking about that any associations, agencies, or groups providing psychological services shall include the name or names of the licensed psychologist or psychologists. I don't know why they did that, but providing or supervising the services on reports, insurance forms, or other official documents or advertisements. So if the committee has any input that they have, I don't have any changes for this.
Any questions from advisory committee members or any recommended changes for this regulation?
So it is saying that for psychologists that are at agencies, et cetera, they would need to have the name of the psychologist on advertisement. So that the last one is what kind of struck my eye. So folks who don't have if they just have their agency name, like XX Psychological Services LLC or whatever, and if the advertisement does not include the name of the psychologist, that would be against the regulation. Am I reading that correctly?
Yes, I believe so. So I don't even know. I mean, it would be up to you. Is this a necessary? I mean, psychological reports, insurance forms, or other official documents, we don't dictate what's on an insurance form. The insurance company dictates that. So I think I don't know that it's
I guess, and apologize for jumping in, is that this is pre-internet, and so what
yes.
counts as like does someone's website or Google search,
Mhm.
and their business shows up, is that technically an advertisement? Does that curiosity make sense?
That's a good question, Jay. That is a good question.
It is.
I had not thought about that.
Yeah, I think you could even say, even if you post it under the practice, if the post is a picture and the picture doesn't say the psychologist's name on it and they move that somewhere, is that a violation?
That is a good
Could be.
question, Chris.
Could get
That's
really
another
sticky.
good question.
Yeah, there's a part of me that would say I would be open to maybe striking this whole thing.
Yeah, I mean, because as was stated, we can't dictate what goes on insurance forms. That's up to the insurance company. Psychologists sign their names anyway on psychological reports, or the name of the psychologist is generally on the report. I would be okay with striking the whole thing unless there's some, if any of you think of some sort of little noodle where this would be applicable, especially to Jay's point, in the day and age of the internet. I think it can get really sticky, as Chris has illustrated.
So I went ahead and looked at this regulation and also the authorizing statute and the implementing statute, and they are very general. So I wanted to make sure this was not referencing back to a specific law that's kind of tucked away or hidden, but that 74-7507 goes with the powers, duties, and functions of the board. So it's just a very general statute. And then the 74-5302 is essentially the definition section for the Psychology Practice Act. So, at least based on what I'm reviewing here, I don't see a specific requirement for this in the statute that would necessitate this as a regulations. So with that said, is there, would the advisory committee be supportive of making a recommendation that this regulation be struck? I see a lot of heads nodding. Is there any opposition to that recommendation? Well, then this is part of the process too. Some of these older regulations, we want to be good stewards of this to make sure that if they're not necessary anymore, we are recommending that they be struck. And so it appears that there is consensus to recommend to the board that this regulation be moved forward with a recommendation to be struck. So we'll go ahead and move that forward to the board. And so thank you for your review on KAR 102-1-14. We'll move next to KAR 102-1-17. And this is a regulation that does tie to a statute. It is not a statute we discuss with a lot of frequency, but KAR 102-1-17 talks about licensees' responsibilities to consult with physician when determining symptoms of mental disorders. And I can tell you this is not exclusive to licensed psychologists. The other professions under the BSRB, with maybe the exception of behavior analyst, have a similar regulation and statute that talks about the responsibility to coordinate care. Alternatively, there is a way for individual clients to waive this practice. But we did want to bring this regulation before you because we don't discuss it very often. And to see if you had any questions about this. And Leslie, did you have any recommended changes for KAR 102-1-17?
No, I did not.
Okay.
And I think the regulation is identical in all professions. And if you're interested, I believe this happened in 1999 legislation is when they created tiered licensure for the master's level LPCs, LMLPs, and LMFTs and gave independent diagnosing authority to those clinical levels. And I think that someone came in and made this statutory amendment, adding the requirement for this, and then this is the regulation. As you can see, it hasn't been changed since 2000. So
Any questions about KAR 102-1-17? Leslie, go ahead. Was there any questions?
Yeah, I was just going to say, I'm in looking at, I've always been opposed to this idea for a psychologist. I think that, psychologists can determine this. It could be a real stumbling block if, something bad should happen. And I mean, if somebody gets into trouble, gets sued, and then they say, well, you didn't consult with a physician about this. And, you just kind of find some reason for it to create a problem. Those are just my thoughts. I don't think it ought to be there at all. I don't know if it would involve, some kind of action on the part of anyone beyond the board to change it. It might make some sense for other disciplines, but I don't think for psychologists it makes any sense.
It would require a statute change.
Yes, and it would require a statutory change, and that can be a whole other can of worms. But that's not to say Ned or anyone else who agrees with Ned's sentiment. Um, I also agree with where you're going with this, Ned. And I would want to take it out of the statute so then we can then take it out of the regulations.
So that might be
Otherwise-
something to keep on our radar if we do move
Introduce a
forward with the
bill.
bill. And it may be outdated. I mean, but I've heard different committees discussing this. And again, this was a long time ago, and perhaps there's more continuity of care with people and different professions now than there used to be. More people are involved, and I know that the regulation was written to kind of soften the blow of the statute. But that's really all that I know about it.
Yeah, and I didn't look at it today, but when I was looking at the statute, I think a couple of weeks ago, did I see exceptions carved out if it was for services for state agencies?
Yeah,
Yeah.
that's the way I read it. That's how we
Yeah.
always
Yes.
read it here.
And so I guess my comment would be if the argument in defense of this is it's best practices to, I guess, ensure quality of continuity of care, why I want to be careful about my wording, but why that state agencies would magically do away with that concern. I have other thoughts about why you might include that, but I will keep those comments to myself. But
Right.
and so I guess just to jump on this, I'm not a fan of this. I'd be curious to see if medical doctors have a converse or an inverse, or to see if they need to consult with us, because we all know about the relationship between mine, and I'll spare us that lecture, but it just it would seem like I don't know, this would be between medical and psychological, a two-way street.
No, it wouldn't. There would not be a reciprocal relationship, Dr. Middleton.
I'm well aware that
Yes, no,
I knew the answer to that question before I said it.
No. But that, I mean, like, now I have to temper what I want to say. I mean, I think to Jay's point, there's a certain ridiculousness may be too strong of a word, but that's kind of where my mind is going. But it's a certain absurdity to this, in that, physicians don't have to do the same thing. Like, why are we subjected to such a excuse me, to such a regulation and to such a statute that physicians are not subjected to in their practice?
And on a very practical matter, I just think about rural care and how it can be very difficult.
Especially, that's a really good point, with the lack of access to to rural doctors, to rural PCPs. I mean, this can make it even more difficult in certain areas of the state, like northwestern Kansas or down where you
Yeah.
are, Jay, in southeastern Kansas.
Or working with populations, people with housing issues, people low SES who you might get in 1 or 2 sessions, and you don't get a chance to consult with anyone because you might not ever see them again or be able to refer them out. And so I see this as a really problematic statute.
Yeah.
And you're making
I
me
think
think like, oh, go ahead, Chris, please, please.
I think my biggest issue is it's so cumbersome on so many levels. And so I think even from a physician's perspective, if you're a single rural physician serving a whole county, a couple counties, and the mental health provider is always sending requests for a consultation, when are we finding? It's just, I think this is just cumbersome on every angle. If there was some, and there's a part of me, I think it's cumbersome on psychology as well. Point E, there's also a part of me that I almost think that last after the or, it almost need like the Witten, I can't never say the waiver, but that whole, it's just a lot of forms, a lot of paperwork. Is there a different way we could do that? Could we talk about patient declines versus turning it into this whole, but I do understand informed consent, but it just seems like an additional cumbersome form.
So I think that, oh, with someone speaking, I'm sorry.
I was just gonna say, so I've made a note that the psychologist would like to, look into removing that from statute, should we do a bill in the future. But do you guys have any recommended changes to this? Since we have to keep it until we
I don't know.
I would just, oh, Bob, please, go ahead.
I mean, I think this is something that's probably being violated thousands of times every day across the state. And I don't know how you save this.
Hey,
I think that maybe the Occam's razor here is to just leave the doggone thing be until there's a change in the statute. And we can, make a recommendation to the board. And Dave, tell me if I'm overstepping here, but we could maybe make a recommendation to the board to investigate the statute. It may not be a bill that would be submitted in this legislature session, but something in 2027 or something like that to revisit this.
I think that sounds like a very reasonable approach. And since this is something consistent for other professions, this may be a way in which we could also maybe bring in some of the state level associations and see if they would be supportive of this, because I think this would be in the best interest of licensees. So I think this might be an area of common ground, potentially in that front too. So, but definitely I could pull some research on when this was first drafted and see if there might be ways in which we could collect more information and have the board kind of talk about it more in depth. So for now, we will just kind of note in the minutes this was reviewed, and at this point, there was no recommendation for changes at this time. And I know we're getting close to the end of time here. I think we probably, if we go fast, we'll be able to finish these last two. So Richard, would you like me to go ahead and just kind of run through those last two regulations?
Sure.
Okay. So moving next to KAR 102-1-18, designation of referral source for use in diagnosis and treatment of mental disorders. The regulation does specifically highlight the 5th edition of the DSM. I believe that the most current version is the DSM
5TR.
5TR.
So we are already out of compliance.
And
yes.
There's been questions from other advisory committees because they have a similar regulation, basically saying, can we just say with the most recent version of the DSM? But this is one of those areas where the legislature has wanted to maintain review because there may be items in a certain version of the DSM that they might have objections to or may become political. So it's been my perception this is one of those they want to keep as a specific regulation and at least have oversight or the ability to make comment if, regulatory boards are thinking about
I'm
updating.
going to unmute.
So I think on this one, that would be the proposed change from Leslie is to switch from the reference of the 5th edition to the 5-TR. Now, Leslie, did you have any other recommended changes for this one?
No.
Any questions from advisory committee members? And I'll stop sharing my screen. Is there any objection to moving this forward as a recommended change? Okay, then we will move that forward as a recommended change. And then moving to the last regulation here. This is KAR 102-1-19, services rendered to individuals located in the state. Similarly, this is a regulation for most of the other professions as well. It basically talks about how we deem someone practicing in Kansas, they are holding themselves out as a psychologist, or in terms of the location of the client, we look to see where the client is actually physically located to see if someone is providing services in the state. And so, Leslie, did you have any recommended changes to 102-1-19?
No, I have none.
Okay. Any questions or other changes from members of the advisory committee? If not, I would recommend that we just make a note in the minutes. This regulation was reviewed and there's no recommended changes at this time. Any opposition to that? Okay. Well, thank you for your work on that. Appreciate that. And I'll turn it back over to Richard. Oh, go ahead, Leslie.
Can I ask one more? Can I ask one thing of the committee? We have a regulation 102-1-16, which is use of computerized psychological tests. And we were planning on doing updates to it, but we need a reference document in number A1 at the beginning of the regulation. If someone who's familiar with that kind of testing, if you could look at that regulation and tell Dave and I what a good reference document would be, because it's talking about the professional standards for testing as adopted by the APA in 1985. So we need something more current. If someone would take on that task, I would greatly appreciate it, and it would help me finish up all the regs and be totally done. Thank you.
I would be happy to do that if someone would send me like an email.
Okay.
With that. I mean,
I
I
will
jotted
do
it
that.
down here, but
Okay. I'll send you the language and ask if you could tell me the newest.
Thank you, Jay.
Thank you.
yeah, no problem.
And Richard, given the time, I'd recommend if you're in favor of it, tabling the rest of the items, with one exception under new business, the date and time for meetings. If there's consensus to keep this on Tuesdays every other month, the second Tuesday of the month at 6 p.m., we can go ahead and send those calendar appointments out. So just wanted to touch base on that in front of the committee. So,
Any objection to that?
okay. Well, I'll have my assistant set those up and we'll send those out to you sometime over the next couple of days.
Well, we're almost done with the review of the regulations. We've got one more left, and I want to thank everybody for their participation in this. It is a process to do this, and thank you to the staff of the BSRB for going through all of these and recommending changes. I look forward to seeing all of you next month, and that is Tuesday, February 10th, 2026 at 6 p.m. Any last matters before I ask for a motion to adjourn? Seeing none, I'd like a motion to adjourn.
Motion to adjourn.
David Stevens, and do I have a second?
Second.
That's Jessica Hamilton, and I don't think that we'll need a vote on this one. I think it'll be unanimous. Thank you all so much, and I will see y'all next month.
Thank you. Thank you very much.
Thanks, everyone.